Absolutely. So, highlighting again the themes of our session, what we've increasingly discovered is first, women are not just little men, that we have unique sex specific risk factors and differences in our cardiovascular risk and even in the types of cardiovascular conditions for which there's a greater susceptibility, particularly in women as compared with men, and that the risk factors are not static throughout the lifetime, so that within the reproductive life course of women, the risk factors and the types of diseases to which women are more susceptible than men in particular change throughout the life course. And so that's why we really need to have a life course view of cardiovascular disease in women, in addition to thinking about a sex-specific view. And so those are the topics that we'll be investigating today. And what's really exciting, it's exciting that the ACC is covering increasingly topics that highlight these sex-specific differences, but that also there's a lot of excitement in this space now that there hasn't been necessarily in the past, particularly thinking about the space of menopause and that being a unique life transition for women in which there's an opportunity to think about risk optimization. Yeah, absolutely. And so what we see is that there is a significant transition around the time of menopause, where we see that a lot of the cardiometabolic risk factors start to increase in the menopause transition period for women, and that it's really that transition period and those risk factors can then lead to increased risk for cardiovascular disease among older women in particular. And so it is an opportunity, I think, around that transition period to think about how can we better help women optimize risk factors. For example, we know that when women present with atherosclerotic acute coronary syndromes, they often have a greater burden of cardiometabolic risk factors at that period of time. So thinking about that transition as an opportunity to optimize even the traditional risk factors that we know affect both men and women. But then also thinking about where are there unique opportunities to address sex-specific differences in risk. And that's, I think, still an area where we need more research. I think it's still an understudied area, and I think I'm hoping that as there's increased excitement about addressing this important clinical gap, that the research will robustly follow as well.